Welcome to Section 3, Lecture 2, where we will continue exploring the upper limbs. So this lecture is going to be all about musculature. From this lecture, you should be able to identify the muscles which provide scapular stabilization, rotator cuff stabilization, flexion, extension, adduction, and abduction of the arm, flexion and extension of the forearm, and pronation and supination of the hand. So there are three classes of muscles which provide scapular stabilization. Elevators move the scapula superiorly, depressors move the scapula inferiorly, and rotators permit some degree of torque around the medial axis. We have identified many of these muscles in earlier lectures when we talked about the back. The two elevators are the upper trapezius and the levator scapulae. The rotators include rhomboid major and minor, as well as serratus anterior. And finally, the two scapular depressors include the lower trapezius and pectoralis minor. The distal end of the scapula terminates in the rotator cuff, which is a functional joint of the shoulder. Recall that from our previous lecture that this joint is called a ball and socket joint, where the glenoid cavity of the shoulder is the socket and the proximal end of the humerus is the ball. Four deep muscles hold the head of the humerus onto the glenoid cavity. These muscles include the subscapularis, supraspinatus, infraspinatus, and teres minor. By contrast, the muscles that move the arm also include coracobrachialis and teres major. There are two main muscles which flex the arm or allow it to move outward and anteriorly. These are the pectoralis major and the anterior one-third of the deltoid. Note that by definition, the arm is the area between the shoulder and the elbow. Extension of the arm refers to moving the arm outward and posteriorly. There are three main muscles which extend the arm, and these include the latissimus dorsi, the posterior one-third of the deltoid, and teres major. So as you will recall, abduction refers to moving the arm away from the midline of the body. Two muscles abduct the arm, and these are the deltoid and the supraspinatus. In contrast to abduction, adduction means actively moving the arm closer to the midline of the body. Three muscles adduct the arm. These include the pectoralis major, latissimus dorsi, and teres major. So recall that the forearm refers to the space between the wrist and the elbow. Flexion of the forearm means actively moving the forearm towards the body, as shown by the blue cartoon illustration. There are three muscles which flex the forearm. These include the biceps brachii, the brachialis, and the brachioradialis. The biceps brachii has two heads and attaches near the coracoid process and the superior lip of the glenoid cavity, which was the ball and socket joint that we just talked about. By attaching so far up near the glenoid cavity, it gives the biceps brachii a lot of stability, permitting a more forceful application to be applied when the muscle is contracted. So extension of the forearm means moving the forearm away from the body, as seen by the red arrow in this cartoon illustration. There are two muscles which extend the forearm. The first is the triceps brachii, which is composed of three heads. Complementary to the biceps, the triceps attaches under the glenoid cavity. Another head of the triceps attaches to the posterior humerus. All three heads of the triceps extend to the posterior aspect of the distal humerus just under the elbow. In addition to the triceps, A small muscle called the acromius also helps extend and stabilize the forearm. Note that in this figure, all three heads of the triceps are not shown for simplicity. So with reference to the hands, there are two rotational planes in which the hands can exist in. These include the supine and the prone positions as shown in this illustration. From our introductory lesson, you should remember that in the anatomical form, the hands are always in the supine position. And this is because when the hands are in the prone position, the radius actually crosses over the ulna. When the radius crosses over the ulna during pronation, the pronator teres muscle also wraps around these two bones in order to hold them in this conformation. There are several other muscles which are involved in pronation and supination, and we'll explore those momentarily. So the primary pronators of the hand include the pronator teres, which we have just discussed, and the pronator quadratus. The primary supinators of the hand include the supinator and the biceps brachii only if the forearm is simultaneously flexed. Okay, so that concludes our short lecture on the musculature of the arm, and I'll end by this quote by S.E. Whitnall, reminding us all to remember the big picture when we're understanding how these muscles interact with one another. For clinical purposes, understanding individual functionality of these muscles is less important than understanding how they work together. So sometime in the summer of 2015, I'll add a module on the innervations of the upper arm, which will help solidify these points. So remember to do the assigned readings for this lecture, and I'll see you in our next section covering the visceral organ systems.